I just want to welcome you back for part four. You know that what will follow this after part four is you will be able to start crafting or further developing the professional development plan. We are going to spend a great deal of time talking about the post-training opportunity that we're going to ask you to complete. And I'll just remind people, as you know, that in order to get your full credit hours, you do need to complete that learning opportunity and submit that to me. And once I okay it, then your credit certificate will be emailed to you, just so that you're all remembering that. The other thing that I'll just add in regard to that, and I think I talked about this on day one, and you'll let me know if it's ringing a bell for you or not. I did mention that there are times when the professional development plan is submitted, and then I follow up with you and may ask you to look at a particular area of it again. Or I may even say, let's set up a meeting to discuss it. So I just want you to know that that can sometimes be a normal part of how we complete the course. So if you get an email from me and it says, and I'm not going to say anybody's name because I don't want anybody to think I'm whatever. But if you get an email from me and I say, hey, could you look at this part of your professional development plan and see if you can flesh it out a little bit more and then just send that back to me for further review? That's a normal part of the process. Or if you get an email from me and says, hey, are you available any of these particular times? Can we check in for about 20 to 30 minutes just to check in about this? Okay. I just want you to know that that can be a normal part of the process. And I don't want you to feel any concern or anxiety about it if indeed that happens, because it's just a normal part of our dialogue about it. Lourdes, I see your hand is raised. Go ahead.
Yes, good morning. Good
Good
morning.
morning.
Good afternoon, everyone. So since this is your topic, I just want to get in to do you have a time frame? How long are you going to give us a privilege?
Exactly. Well, what I can tell you, it's between 1 week and 2 years. No, I'm kidding. It is not you. We will give you, I'm kidding, Eunice. I'm totally kidding. We will get, I know the mail from Brooklyn takes a little while, the email from Brooklyn, having lived there. Um, we will give you Tree Chapel, who's also in our learning community today. Tree and I are going to put our heads together and we will give you a specific, you'll have at least 5 business days to work on it. And we may even give you a little bit more, but you can definitely send it in sooner than that if it's complete sooner than that. So don't think, if you have 5 business days that, well, I have to wait until, the fifth day, because keep in mind, as soon as I get uh, your professional development plan, I then will review it. And the thing I also will just add in regard to that is that I will review it in the order that they are received. So just keep that in mind too. So, the sooner you get it in, the sooner you're going to get feedback and then hopefully get your credit. Keep in mind, Amber says, I'm glad you said that. I have an issue comprehending in this understood. I totally understand that, Amber, and you shouldn't hesitate to ask any questions that can further clarify it. I'm happy to address anything that maybe I haven't verbalized at this point. So, Lourdes, to your excellent question, you will have a minimum of 5 business days to complete it. You may have a bit longer. And again, the thing that I want to let you know, because I respect our relationship in the learning community, if for some reason you need a little more time than the deadline we set, for whatever reason, if you need that, you should not hesitate to say, hey, Paul, Tree, could I have a couple of extra days, or could I have, again, the sooner you get it finished, the sooner I can review it and the sooner I can give you feedback. But I don't want you to feel like if it would benefit you to have a couple of extra days, and again, we may make it more than 5 business days. So I just want you to know that I want to be responsive to what your needs may be in regard to it. Okay. And again, there will eventually have to be a cutoff in the sense that, if you don't meet the deadline and there isn't some extenuating circumstance that you've kind of let Tree and I know about, we kind of can't work with you unless you work with us in terms of letting us know what you may need. Okay. Lourdes, any thought, any reaction to that? Does that answer your question? You'll have at least 5 days.
Yes, sir. That is understandable, and thank you so much. However, I have a follow-up question, which seems to be
okay.
very, very basic. The form.
And you may not be alone. Go ahead.
The form, it seems to be, in other words, do I have to stick to that form because it seems to be the space. I mean, I don't know how it goes. This is my first time, so do we have to do another form? What how do you do this? Thank you.
Again, a fantastic. You're asking all the excellent questions, and there are no unexcellent questions, by the way. So if you have a question, put it out there. But in regard to what you're saying, yes, you do have to use the form, and the form will give you more space if you need more space to fill something in.
Okay.
And if you need to just go onto a blank page and say, I'm listing out the supervisee strengths, and the form isn't giving me enough space to do that. Therefore, I'm just letting you know on this separate page, this is a continuation of the strength. But the form, you do need to complete the form.
Okay.
So, Lourdes, since you're kind of a trailblazer here, before we get to what I asked you to prepare for today, and I'm confident as we move forward today that there'll be additional questions, but I just want to open it up. Are there any other specific or questions or concerns that you have about the post-training assignment that we're asking everybody to complete? And again, keep in mind, folks, we're asking you to complete this assignment for 2 reasons. One, it fulfills the complement of the hours associated with the course in order to generate the certificate. So that's one reason. The other reason, it's a demonstration that you are able to operationalize the use of this particular professional development process, a professional development plan process that you, quote unquote, as a supervisor, if you choose going forward, you can use the resources that are available, TAP 21, and you can develop a professional development plan based on that in combination with the rubrics. Okay, so it's also a demonstration, and I love the way Dr.
Is it just me? Is he frozen?
No, it's not just you.
Okay. I'm like, wait.
Okay, he's back. We can't hear you.
You're frozen.
Can you hear me now?
Yes.
Fantastic. Okay. So I don't know why it decided to throw me out when I said, I love the way Dr. Holly put it. I don't know if you heard me say that. I did say that. I said, I love the way Dr. Holly put it when she likened it to the sort of like a capstone project. If you were in a program and you were finishing up, you would have kind of like a final project, a capstone project that you would actually complete. Okay. Any other questions or anything else you want to put on the table or ask about the post-training opportunity? Dr. Holly, I see that you're
I did have a question. You mentioned earlier, and I just want to confirm, it could be a fictitious supervisee or one that we currently have.
Yes, we're going to talk about that.
Okay. All right, no problem.
No, but I'll address it now since you brought it up. I love that. So you have a choice, and I'm going to give you a couple of choices. Choice number one, it could be a real supervisee that you have already. And I also want to acknowledge there are some people who have told us in the learning community, and Lourdes, I'm thinking of you, you had told us that you don't supervise anybody right now. So that's actually not going to be a viable option for Lourdes because she doesn't supervise anybody. If you are supervising somebody, you can do a professional development plan that would be specific for that person. So that's option number one. Option number two, and I mentioned this earlier, Lourdes, and I know that you had requested this in advance. You will get it after today's training. Well, actually, you have it already, believe it or not. Is that there is a scenario that you can use that's a particular staff person in this particular scenario. And you can use this scenario to craft their professional development plan. And there's one additional option that I'd like to give you. And I've been thinking about this since day 2 of our conversation. And I'd want to throw this out to you as an option. And you don't have to take this option, but I'm just throwing it out there that you can use it if you want. If you want to put yourself in the role of the supervisee, and sort of imagine if you're thinking of yourself as the supervisee, because some of you may actually be clinicians who have a caseload and providing direct services. So if you're able to sort of shift your thinking and think about yourself as the supervisee, you can actually use yourself as the supervisee, and then you will put your supervisor hat on and develop a professional plan for yourself as a clinician. Okay? So I want you to know that that's an option that you all actually inspired me to think about and to share with you. So you can do that option too. Yeah, go ahead, Ms. L.
Is this going to be in writing? Like, will you will, right?
Yeah. I'll and I'm going to say it again at the end, but there are basically 3 options.
Okay, good.
A real supervisee that you are actually supervising, somebody who's not you.
Right.
The scenario, which is the fictitious one. And then you can also cast yourself, if you're able to think that way, if you're able to like mentally arrange it, you can think of yourself as the clinician and identify the particular capacities and then develop the professional development plan that way. Okay? And yes, Maisel, I will put that in writing and I will send it to you as well. And I'm glad you asked that, because for some people it may be really helpful. You may be thinking like, well, what did Paul say exactly? And now I don't know what to do because I'm sitting in front of tab 21 and I'm sitting here with the rubrics and I don't know exactly what to do. And you will have that so that you will know what to do, which you can go back to doing. Okay. Yeah. Alexine, please, the floor is yours.
Just for clarification, if I use option 1 or 2, then I'm going to have to draft what the scenario is, the paragraph of the scenario, or not?
Nope. Option 1, which is the real sort of person, you don't need to give me all the backstory on that person. All you need to do is complete the parts in the plan that address the person's strengths, the person's concerns. If you want to provide background, I would accept it and be very thankful for it, but it's not necessary. The second option, you will be provided the scenario and the supervisee So you can simply base it on that.
Okay. Thank you.
Yeah, you're welcome. Of course. Great question. Any other questions in addition to will it be in writing? Are there any other?
Well, I would ask, how many competencies will we have to use?
Yes. So Eunice, you're now moving into how many pages does this have to be? Kind of. And keep in mind, Eunice, I will be reading these pages.
Oh, that's true. Okay.
Yes. So, so we're working together on that. So what I would say, just so that it's a meaningful opportunity, as opposed to just busy work, because I'm not a fan of busy work for anybody, is I would say a minimum of 3. A minimum of 3. You don't have to do any more than 3. If you want to, again, let's say Amber is doing her professional development plan on an actual supervisee. Okay, let's say that's the choice she makes. And let's say she identifies, and Amber, I'm not suggesting this, but I'm just saying as an example, let's say Amber identifies 5 competencies that she wants to focus on because it's real. It's for this real supervisee. If she wants to do 5 and she wants to, walk through the thing for those 5 competencies, I'm okay with that. So that means, back to Eunice's page question, that means that it would probably be 5 pages because it's usually 1 competency per form. You'll notice it says in the line, competency, not competencies.
Oh, okay, let me pull it up because I'm glad you mentioned that. So
Yeah.
what you gave us as far as the professional development plan, that's
Yep.
only per 1 competency.
Competency. Yep.
Wow. Okay.
Yep. And what I'm going to suggest that you do is, and again, to Eunice's excellent question, and of course it's an excellent question. Eunice is in Brooklyn. 3, a minimum of 3. Okay. So go ahead, Deborah, and then we'll come to Lourdes. Go ahead, Deborah.
Okay, so when you say 3, so the professional development plan, if they have 3 competencies, right?
Yep.
So the first page where their name, the staff, and all that information, you want that 3 times?
It's not necessary. If on the first page you do that, all I need on pages 2 and 3 are the competency, the rating, and then the plan. That's all. Yeah, you don't need to repeat it. If you want to, you can, but you don't need to. I'm fairly
Okay.
quick on the uptake, so I would figure out that you're talking about the same person.
And you want at least 3?
Yes, a minimum of 3, and we have Eunice to thank for that. So now
Okay, thank you.
Deborah, you can let go of the 10 that you were gonna do, and you really only need to focus on 3.
3, okay.
So we're gonna go to Lourdes and then to Tricia. Go ahead.
Okay, Paul, this is in reference to the rubrics. I just kind of curious. Now I'm looking at the form.
Yep.
Where I know I read the rubrics a little bit quickly. It is 100 plus. Yeah. Correct? 120 something.
Yeah, so, because remember, Lourdes, and I want to link this for everybody. Remember, TAP 21 is linked to the rubrics. TAP 21 identifies the competencies for the counselor. It gives a definition of what makes up that competency. And the rubrics is the ruler for each one of those competencies so that you can assess on that 4-point scale where that person is in their level of competency. So the rubrics is the companion ruler to the competencies. Go ahead, Lourdes. I'm sorry I interrupted you.
No, you don't have to say sorry. It's true. I read it too that it's both for counselor and supervising. That
right.
However, my only thing right now, I'm trying to put it together in my brain.
Yes, of course.
How do you put it into this form? Because I believe before we can come up with this, we have to do that rubrics, right? Is that right?
Well, your point is a wonderful one, and you are kind of leading us into what I asked you to be prepared to discuss today, which is I sent you a modified professional development plan that there was a section that was highlighted.
That was highlighted.
Yeah, do you remember that? The part that was highlighted? And it was the 1 through 4 scale. And my question is how does that relate to the rubric?
Right.
Right. Yes. So I'm wondering, can anybody answer that question? How does that relate to the rubric? And if you feel you can answer the question, yeah, go ahead, Dr. Holly. Yeah, and Tricia, don't lose your thought. We'll come right back to you. Don't lose your thought. Go ahead.
The rubric basically gives you the numbers 1 through 4 as a guide for you to mark where does if I'm processing it correctly to say where the supervisee falls between a 1, 2, 3, or 4.
Correct.
So if I'm looking at, let's just say I'm on page, I think this is 20. And it says number 9, understand the established diagnostic criteria for substance use disorders, describe treatment modalities, placement criteria within the continuum of care. So you have awareness, understanding, applied knowledge, and mastery. Right. So if the awareness is 1, understanding is 2, applied knowledge is 3, mastery is 4. Yep. So you will read those 4 areas, and then based on, I'm assuming what the supervisee needs to work on and where they are strong at, you would indicate the number 1, 2, 3, or 4.
You got it. So basically, and Dr. Holly, I'm just going to repeat what you said and tell me if I'm getting it correctly. What Dr. Holly is suggesting is we would identify the competency.
Okay.
So we know that person, this is an area for that person. We'd look at TAP 21 and we'd understand these are the components that make up this competency. We would then turn to the rubric and we would find that competency number. And let's just say for the purposes of our conversation, it's competency 24. We would find out where in the rubric is that competency listed. And for those of you who may have taken the initiative or your mission, if you chose to accept it, what page in the rubric is competency 24 on? And I see people holding up 3 fingers. I see people typing 30 into the chat. So I think it's 31. I think it's page 31. At least when I did my research, it was page 31. Go ahead, you thought it was 30?
No, I thought it was 38, but I'm off, so it's 30 something.
Okay, well, let's all go to the rubric right now. You have it handy, hopefully. Let's all go to the rubric together. And let's find where competency 24 appears and is rated. Now, for those of you who said 30, it may be listed on page 30, but it's actually rated, I think, on page 31. So let's look at the rubric together. And if you've got your rubric and you've got it handy, please just type a Y in the chat to let me know that. And for those of you who said it was on page 30, I'm not mad at you. You are correct. It is listed there, and it's actually rated on page 31. And if you look at page 31 in the rubric, you'll see that it lists the competency. And if somebody would be so kind as to unmute and just read the competency out loud to us from page 31, would somebody do that, please? Just read it out loud.
It's 31.
Yep. On page 31. Can somebody just read?
Establish rapport, including management of a crisis situation and determination of need for an additional professional assistance.
That's it. You got it. Now you'll see underneath that, folks, appears the definition of awareness in regard to this competency, the definition of initial application of this particular competency, competent practice, and mastery. You'll see that each one of those correlates with that rating of 1, 2, 3, or 4. 1 meaning mastery, 2 meaning initial application, 3 meaning competent practice, and 4 meaning mastery. Okay? So if they were getting a rating of 4, chances are that this may not be part of a competency, a professional development plan, because they've already achieved mastery. And a professional development plan is identifying how the person may want to grow. Now, the person might be at 3 and they would be in competent practice, and the goal is to help them to move to 4. And then the plan is crafted to help them move to 4. Okay?
So
yeah, go ahead.
So
no, go ahead.
The competency, this not discrepancy. The person is lacking, as we identify from tab 21, the establishment of rapport. He's lacking that. Is that what you're saying? We identify that he's lacking that competency. So
yes. What we're lacking is what we're acknowledging, not lacking, but what we're acknowledging is that this is an opportunity for professional development for this person.
Oh, okay.
And then we are assessing where we believe they are. And I know it's a little bit difficult to talk about this in the abstract because we don't have a supervisee or scenario in mind. But I just want you to understand mechanically, this is how it works. And it's simply so that you have a standardized ruler,
right,
that you can assess where this particular person is, where you kind of want them to go, and how then you help develop the process of how they'll get to where you want them to go. Okay.
Sure. Thank you.
You're welcome. You're welcome. Again,
hey,
folks,
Paul,
yeah, go ahead, Charles.
just,
and then we're going to definitely go to Trisha after Charles. Go ahead.
My bad. I think also have to be realistic in that, in terms of timelines, right? So if you identify someone who has basic awareness of this competency and our goal is to get them to mastery, that could take a long time. I mean,
yes. So 4 may not be the goal. If they're at 1, 2 might be the goal. And then you can be more realistic about the timeline. Yeah. Excellent point, Charles. And again, it's those kind of things that I'm going to be looking at in terms of what you put together. And keep in mind, folks, this is one method of supporting professional development. Trisha? Comment, question, passing at the moment? You're going to pass. All right.
I have a pretty good idea now. I was a little like, I wasn't going to come on today, but I figured let me get here and actually learn it. I feel a little more confident now with us going through it together. and being able to decipher between the one, the twos, and the threes, and where the supervisee is at, and being able to move them to the next level, and using mini goals, not just the larger, but yeah, it comes together for me now.
Fantastic. Fantastic.
Yeah.
And the fact that we've kind of talked about it in the learning community has increased your confidence.
Yeah. So now if you can go over like finding them again, that going over the tip, because there's the tips and the taps. So I don't want to get confused.
There sure are.
I don't want to get confused with the tips and the taps. So I have to stay focused on the tap 21 in order for it to go with the rubric. Okay.
Yep.
I'm better. I feel confident now. Yeah.
Absolutely. And Eunice, thanks so much for putting it that way, because what I want you to know, folks, and we are going to talk a little bit about tip 52 in just a minute, but what I want you to know in terms of the work that we're doing together in the learning community, and then the work you're going to do on your own in regard to the professional development plan, is all you need to really focus on is the use of the two tools together, which is TAP 21 and the rubric. Okay? Tip 52 is another resource. It can be very beneficial, but we're not integrating it into this particular activity that I'm asking you to engage in. Okay, so I really appreciate Eunice's point of that. Try not to let these other resources confuse you or derail sort of the work that you're going to do after. I also want you to know I'm going to do my best in terms of the use of our time today. I'm going to do my best to leave a bit more time for us to discuss this even further. Okay? Lourdes, I think you wanted to comment or say something.
Oh no, this is another thing, but hopefully I'm not taking a lot of time. I've seen the target, and I think I'm following the thought of Charles about the target date of each competencies. At the top of this form, in line with the level of proficiency that I see it, there's a target date to complete the plan, but there's another date with target completion date on each knowledge, skill, and attitude.
That's right.
So now, my question is this dates, or are these dates depend on the policy of the company, of us, or who set these dates?
Those are dates that you and the supervisee, or you as the supervisor, if you're using the scenario, and even before a conversation with the supervisee, you as the supervisor might be setting those dates. If there are outside factors, like the agency says, there is a mandate by October 31st, which happens to be Halloween, by October 31st, everybody on the clinical team needs to demonstrate proficiency with the evidence-based practice of motivational interviewing. So if you're doing a real scenario and there are real extenuating timelines, and keep in mind, and I think this is the spirit of what Charles was saying in terms of the realities of timelines, that this is just simply a guide, or it's a gentle pin in where you're hoping that there'll be growth demonstrated by that point. It may or may not play out that way, but that's what you're hoping. These professional development plans, folks, are not in stone. They are in wax. They can be molded and reshaped. Okay, so you determine, quote unquote, in your role as the supervisor, and again, I love Charles's point, as to what's realistic and what the process is going to be. And I'll give a concrete example. Let's say, this is just a concrete example, I'm not citing a particular competency, but let's just say generally, the supervisee needs to attend a training on cultural humility. Okay? You could set very clearly based on that training schedule or whatever, we know that this is the date by which this person will have accomplished this particular goal. Remember, folks, the professional development plan helps us to be able to measure realistically progress. And part of doing that is setting timelines of when certain activities need to be completed by.
Sure.
So it helps keep it specific.
Sure.
Okay. All right. All right. Any other comments or questions? Because I don't want to push forward until maybe anything that's distracting you or causing you anxiety at this particular point. I don't want to go forward until, if you want, you felt comfortable enough to put that out on the table. So is there anything else that may be distracting you or causing you anxiety about this post-training opportunity that you want to put on the table at this particular point, or it would be helpful for me to comment on, or something that you want to share in the learning community? Okay. Yeah, go ahead, Giselle. Yeah,
can we leave like maybe the last like 7 or 8 minutes of class to kind of talk about it more?
In fact, we can leave even more
okay, great.
time than that to talk about it. Absolutely. Okay. Yeah, okay. I've tried to build in the last 30 to 40 minutes, which means that we have kind of, we're going to really look at some things and move forward. Okay. But I want to leave the last 30 to 40 minutes for us to revisit this based on what we've talked about.
Okay, good. Yes.
And I will be managing, making sure that happens. Okay. Excellent. All right. All right. So folks, I'm going to share my screen. Just going to remind you of a couple of things, and just confirm in the chat. You can type a Y in the chat that you can see the title slide, just to confirm that for me. Excellent. It looks like people can see it. Good. All right. You'll see that we are at September 21st. We are at part 4. Our learning community conversation continues today, and hopefully I say this with all sincerity, my hope is that we will have the opportunity to be together in future learning community conversations about clinical supervision or other topics. And as you know, because this is a learning community, what we talk about, what we look at in terms of accomplishing the goals that we've set for ourselves in this conversation may not necessarily reflect the views of our funder. Are making sure that we put language and people, that we're using language that is welcoming, inclusive, and respectful is still in place, as are the other guidelines that we asked. And people have continued to follow these guidelines, and I thank you for that, making I statements, giving each other the floor and the respect to make your points. Thank you. And again, I appreciate your notice when you have to step off camera and just letting me know that. Thank you. And I will just repeat, and I know you know this, but don't hesitate to interrupt me as you need to. So I hope that this slide, and Eunice, this one's for you. I hope that this slide will sort of clear out all the clutter in terms of what I'm asking you to do is use for the professional development plan TAP 21, TAP, not to be confused with TIP, 21, which is the addiction counselor competencies, in addition, in partnership, in tandem, and in collaboration with the rubrics, okay? They work together. They're a very good team. Those are your tools. Those are the 2 things you want to have handy, in addition to your 3 pages minimum of the professional. That was also for you, Eunice. The 3 pages minimum for the 3 competencies that you're going to identify. So, a couple of things. to keep in mind as we think about professional development plans and as we think about clinical supervision. We, of course, are assessing, and the rubrics help us make an informed assessment of a person's job performance and their professional development. And hopefully that's in the context of a supportive alliance or supervisory alliance collaboration with that particular person. We also hopefully want to make sure that we're linking the person's performance, the supervisee's performance, with criteria and evaluation methods. And again, that's where the rubric is so helpful, and TAP 21, because we're not just generally saying we're identifying a specific competency, we're understanding what makes up, what's the meat of that competency, because the TAP defines what makes up competency 24, and our supervisory conversation is based on criteria and a way to less subjectively evaluate that criteria. Okay. And again, we are hopeful that the supervisee is going to engage in continuous learning. And we can also, by engaging in this process of performance evaluation, developing professional development plans, that we can assure the agency's mission, the quality of the care, and the safety, and it really should say this on the slide, and it should say it first, and the well-being of the clinician, of the counselor. Okay? So that's kind of a layout in a very general, very broad way of why we're talking about and thinking about performance evaluation, which the professional development plan is one of the tools we use. So before we go to this case study, because I have a case study that I'm going to ask us to read together, I just want to remind you that as part of what I asked you to prepare for last time was 2 readings. And if you remember which resource I asked you to do those 2 readings in, type it into the chat. If you remember which resource, Brittany D, yes. Yes, everybody, yes. Tip 52. For extra credit, if you remember what pages I asked you to read, type that into the chat. Yes, fantastic. Now, I'm not going to ask you to type this into the chat. I'm going to ask you to just rhetorically think about it. Did you read those pages? So you're on the honor system there. You're totally, all right. Some people are saying yes, they're giving a thumbs up. But I'm not paying attention to anybody who's not doing that at this particular point. So again, I want to thank you for reading those pages if you got the chance to. If you didn't, please do. Only because I wanted you to be acquainted with that particular resource. Now, what I'm going to ask is if you have your resource handy, if you have Tip 52 handy, and you may have it handy in paper form or physical form, or you may have it handy digitally. But if you have it handy, please turn to page 13. So if you're able to turn to page 13, please do so. While I turn to page 13 myself. Now, there's a particular paragraph that I'm going to read to you on page 13. And keep in mind, folks, who this resource is for. Okay? Remember, this is the resource for the supervisor. So this is the paragraph I'm going to read to you. It's pretty much at the top of page 13. So I'm going to just read this out loud to you. Beyond self-examination, supervisors will want continuing education classes, workshops, and conferences that address cultural competence and other contextual factors. Community resources, such as community leaders, elders, and healers, can contribute to your understanding of the culture your organization serves. Finally, supervisors and counselors should participate in multicultural activities such as community events, discussion groups, religious festivals, and other ceremonies. Now, that was on page 13. Yes, page 13. Now, the reason I wanted to share that with you is I wanted to underline that this is a resource for supervisors. This particular area is talking about culture and cultural humility. And it is suggesting what is a way for supervisors as well as counselors to continue to develop their understanding of culture and different cultures so that they can be more effective with their supervisees as well as their clients. So I just want to ask, before we look at pages 44 through 51, any thoughts or any reactions to this particular reading?
I'm definitely gonna scream that this is definitely needed, because I just started a new position at a new placement. And of course they wanted me to attend a training, cultural competence. And I was screaming like, oh no, I did this already. I don't want to go do this. And it was like, I even have a certification in it. So the supervisor very nicely said, I'm just going to ask that you attend, and then you can report back, based on your findings, your learnings. And of course, I was happy that I did go after stomping, because, time changes, your positions change, and you see things in a different light. So I was all very happy after I stomped and screamed, but I did go. And it was interesting, it was learning, and I liked the style in which he was teaching. It was totally different. So I learned so much. So yeah. So as you read this, you're going to always have to continuously increase education and knowledge for yourself in wherever you go. So yeah, thank you for listening.
Yeah, thank you, Eunice.
Yeah.
Lifelong, ongoing.
Yeah.
And the reason I chose that particular paragraph is I want to draw a parallel here, that in your role as a clinical supervisor, my hope for you is in this area and every area, in every competency that would support you being effective as a clinical supervisor. I hope that it will be a forever ongoing, on-growing process for you. Okay? So what I'm going to ask you to do now is, still in this particular resource, which again is not going to be part of, at least directly, it's not going to be part of the work you're going to do in terms of developing the professional development plan. I'd like you to turn to page 45. So turn to page 45 in this resource. And I'm going to do the same thing, because I have it handy right here. And you may remember that page 45 was a particular scenario. And if you've arrived at page 45, just type a Y in the chat and let me know. If you've arrived at page 45. Excellent. Good. Now, I'm wondering, is there someone who would be willing to read out loud? Now, keep in mind, folks, in this resource, This is one of several scenarios that's included. They very clearly lay out at the beginning what the purpose of this scenario is and why they're inviting you as a clinical supervisor to be exposed to it and consider it. Okay? What I'm going to ask is for a volunteer, if there's someone who would be willing, and you may know that this is a conversation between a supervisor and a supervisee, where the supervisor is trying to build enthusiasm and openness for clinical supervision as well as direct observation. Okay? So if there's someone who would be willing to unmute and read out loud just Bill's first line. Is there some? Yeah, go ahead, Brittany Davis. Thank you so much. So if you would just read Bill's first line out loud. Now, the thing I want you to be thinking about before Brittany does that for us is I want you to be thinking about intentionality of what the supervisor is doing. Okay? That's the only question I want you to think about. Let everything else fall out of your mind at this particular moment. Excuse me. Intentionality of what the supervisor is doing. And Bill is the supervisor. I believe it's Bill. Yes, Brittany? Yeah. And Brittany is going to now read what Bill says as his opening remarks to this new supervisee. And I want you to be thinking about intentionality. Brittany, thanks so much.
Mm-hmm. We're excited to have you here, Jan. You may already know that supervision is an essential part of how we help counselors in the agency. Since this is our first session together, perhaps we can explore what you want from supervision and how it can help you. Building on your training and experience, maybe you can give me some ideas about the areas where you wish to grow professionally.
That was beautiful. I wish that my supervisor was Brittany and would be saying that to me. Okay. And I mean, I have a great supervisor and we've, worked together for over 18 years. So, and he does say things like that to me, but I just loved Brittany's tone of voice in terms of the way she said that. So thank you for that, Brittany. So I'm going to invite everybody to be thinking about this, but maybe we can hear from two people who unmute. As you heard what Brittany read, and maybe you read it already, because this was part of what I asked you to prepare for today. But you heard Brittany read it again, and she did a beautiful job. What is Bill's intention in what he just said? What is his intention? And let's hear from two people. What do you think, based on Brittany's excellent reading of Bill's opening remarks? Yeah, we'll start with Charles. Thanks, Charles. What do you think is his intention?
I think he's gaining the groundwork to start the development plan, trying to gauge the awareness of the supervisee as the areas of potential growth, and that could be a starting point for building the plan.
Fantastic. Yeah, thank you. And I have to be honest, Charles, I never quite thought of it that way. And I think that can absolutely be going on in that first conversation. Any other thoughts, folks, about what? Yeah, go ahead, Lourdes. What do you think?
Okay, so I think, as Charles said also, it's the supervisor is trying to explore, of course, exploration, and he wants to identify the areas of this person that needing to be helped with. It's like doing what is the problem at this point that I can help you, or this supervision can help you grow. Identification, I think. Exploration and identification of the areas. That's what I think.
Fantastic. Fantastic. Yeah. Alexine, please go ahead.
I think the other thing, he first made her feel like she's a vital part of the organization and they're happy to have her be a part of the staff. So include it, welcoming and making her feel included in this process. So she's going to embark upon.
Agreed. 100%. 100%. Lourdes, did you want to add something?
Oh, no, I have to lower my hand. Sorry.
Okay. All right. No problem. Thank you. Yeah. Juliana, did you want to add something? Or you were just waving? Okay. Hey. Okay. Excellent.
I would like to add that basically, remember when we first talked when we was talking in the beginning of the week, this would be an opening opportunity for her to be able to share if she had any past experiences and may want to open the floor for that discussion there. That's what I was thinking.
Yeah, absolutely. And Letitia agrees with that. I'm going to throw out one other thing. And if you agree with this, you can give me a thumbs up. If you think I'm crazy, you can give me a thumbs down. If you're not sure if I'm crazy, you can do a thumbs in the middle. But I would throw out, I also think the thing that Bill is doing, and I'm kind of thinking of Charles as I say this, because you alluded to this, Charles. You didn't say it directly, but I think I heard this in what you said. He's setting the groundwork for a collaborative partnership. He's intentionally setting. So if you think I'm accurate with that, give me a thumbs up. If you think I'm sort of, or if you think it's crazy this way. Yeah. Okay. So it seems that people agree. Okay. Thank you. All right. I wasn't making that up. So Beretta, did you want to add something or you just agree?
Yes, I believe that he also wanted her to realize that supervision is an important part of the agency policy.
Yes.
And he wanted also to realize or to be aware of our developmental needs as well.
Yes.
So it was building a working alliance with her. He also wanted her to realize that supervision is a part of the agency policy. And he wanted her to realize our awareness of her personal developmental needs.
Fantastic. And I love the way you put it, a working alliance, a collaborative partnership. Excellent. So folks, I wanted you to see that as a resource, but I also wanted to be very clear that we can be intentional in what we're doing. We can intentionally lay the groundwork for the kind of working alliance. I love the way Beretta put it. We can intentionally lay the groundwork for the working alliance that we want to build with this person. Okay? So the only other thing that I'm going to ask you to prepare at the conclusion of our time today is, the work on your professional development plan that you'll set in. But the other thing that I would throw out for you to consider, and this is, I know your plates are very full. What I would invite you to also consider is if you ever had the time or the interest to go back and just look at that scenario again, pages 44 through 51, and just look at it from the perspective, and I'm going to frame it this way, of Bill's intentionality. Because it's not an accident that he says to her, "We're excited that you're here." That's not an accident, folks. And that's not just being nice. That's commitment to a working alliance. So I just invite you to consider, with no pressure whatsoever, just throwing it out there as an option, because of course we know, based on our conversation the second day, how chock full of resources this particular slide deck and all these tools are. I invite you, just because we've talked about it here, because of Brittany's excellent reading of that, I just invite you to go back, if you can, and look at that scenario, pages 44 through 51 in tip 52, and just think of it from Bill's intentionality. There are no accidents in regard to why the supervisor is saying what they're saying. And sometimes we do say things that aren't as effective as others. And just like that parallel process, we can reflect on our own practice and become more intentional and more effective. Okay. Any final thoughts about this before we go forward into another scenario? No? Yes? I think Charles maybe, no? Juliana, no? No, Charles, you're okay? Okay. Okay, all right. So again, just an invitation, folks, with absolutely no pressure. And again, thank you for looking at that a little more deeply, just as digging a little deeper into it as a learning community. Charles, any final words on that? No? Charles B. I'm sorry, Chris. Chris, any final words on that? Nope. Okay. All right. All right. Just want to check. So folks, I'm going to ask you to go to your workbooks, and I'm going to ask you to turn to page 50 in your workbooks. Okay? And if somebody would be willing, once you get to page 50 in your workbooks, if somebody would be willing to tell me what they find on page 50, that would be great. So what have you found?
Supervisory interview.
Yep.
And performance evaluation at the bottom.
Yep. And it's the case study, right?
Yes.
And that we're at page 50, yes? 50 or 52?
50.
50. Yep. All right. So this is a scenario. It's a scenario that involves what a particular worker does in terms of their interactions. I'm going to read it out loud to you. Hopefully I will do as well as Brittany did, but I will do my best, Brittany. You'll let me know. Hey, thank you. I appreciate your support. I'm going to read it out loud to you. Not a problem, Juliana. Just let me know when you're back. That's good. Excellent. So I'm going to read this scenario out loud to you, and I want you to put your supervisor's hats on. Now, I want to say something about that. At this particular moment, I'm not necessarily suggesting that you have to put your supervisor hat on so tight that you're thinking about the professional development plan. I'm just asking you to put your supervisory hat on to just formulate your initial impression. Okay? It's not on so tight that we're thinking about professional development plan at this particular moment. Okay? We're just getting your impression. All right. So I'm going to read the scenario out loud to you. So this is the case study. Tony is a 28-year-old Mexican-American seeking outpatient treatment for alcohol and heroin addictions after being confronted by his girlfriend, Laura. Recently unemployed as a car salesman due to absenteeism, Tony's sole source of support is Laura. They live together with her 2 children. His drug and alcohol use began at the age of 13 prior to moving from Mexico with his mother. His mother has supported him in the past, but is now refusing to have anything to do with him since he took all her jewelry and money to purchase drugs. Laura indicated she is afraid of Tony and wants him to leave her home. He frequently becomes violent when drinking, and her children, ages 3 and 11, are afraid of him. Tony denies any violent behavior, but states a willingness to find a place of his own. Laura plans to loan Tony enough money for his first month's rent. Tony reports being diagnosed with hepatitis C and diabetes. He has been prescribed several medications, which Laura has been paying for through her insurance. He has no resources to purchase the meds himself. His affect seems quite flat, and he reports that the only positive things happening in his life are the feelings he gets from shooting dope. Megan is the counselor who did the initial assessment of Tony, which was audio recorded as a routine procedure. In playing back the interview, the supervisor, which is us, the supervisor noted Megan seemed to establish good rapport early in the interview, and Tony readily acknowledged a need for help. He discussed his drug use openly. However, he could not identify any ideas for how to help himself or what he should do next. His personal goals were vague, and he did not seem particularly concerned about the future. Megan seemed uncertain about how to facilitate an exploration of Tony's current needs and any vision he might have for the future. Her inquiry about available social supports was brief and cut short when Tony became upset in describing his mother's refusal to help him. He denied the need for medical care and seemed hesitant to seek public assistance and unemployment benefits. Megan scheduled Tony for another appointment the following week, at which time she said they would develop a treatment plan. Tony left with no plans for the interim. End of scenario. Okay? You have your supervisor hat on. It's not on so tightly that you're thinking about professional development at this moment. As a supervisor, Megan is your supervisee. As a supervisor who listened to the audio recording, which is a form of direct observation, as the supervisor listening to the audio recording, what's your initial reaction? What comes up for you? Welcome back, Julia. Thank you. Juliana, thank you. What's your reaction? Yeah, go ahead, Zachary.
My initial reaction with the case is if he's using heroin, he should have left with a plan to, see someone for MAT. We should not have waited for a second assessment to get him with the doctor because, he could very well overdose and die.
Okay. So that raises to the top for you, Zachary, yes?
Absolutely.
Got it. Thank you. Yep. Thank you. Any other thoughts? Anything else come up for you? Any other thoughts, folks, that you have? Any reactions that you have to listening to Megan's audio recorded session? Again, your hat's not on so tight. You're not thinking about professional development, just your reactions. Go ahead, Lourdes.
Yes, I think absolutely 100% because it's a heroin case that math is important. However, there with Megan, I'm giving Megan credit for being, she establishes a good rapport with this client because first thing first, if we cannot establish rapport, no matter, we cannot do referral. The referral is the most important thing for this person. That is one thing that I like with Megan. Although, as she needs more help. As I'm wearing my hat not so tight, so I understand.
Yep, don't wear your hat too tight right now.
Yeah, and also another thing, I also so from the client that remember from the first statement, the client seek the help. He went to the treatment by himself, I believe, with the encouragement of Laura. So that is a good, also, I see that also as a credit for the client. So there is a good...
Understood. Yep.
That's my base.
Got it. So Letitia writes in the chat, definitely harm reduction, high risk behaviors needs a plan until next session. Okay. So again, rises to the top. Juliana writes, this client is high risk because of medical conditions and lack of resources. Yep. And Julie writes, needs a plan for risky behaviors. I would say harm reduction. Does he have Narcan, fentanyl, test strips? Yes. So again, these things didn't happen in the session, but you're identifying that there's a high risk situation, and you're even identifying some of the things that should have happened that didn't. Go ahead, Deborah.
Again, I definitely see him being at a high risk, and I would have more or less spoke to him about going into detox.
Okay.
And this, I mean, because he loves getting high so much, and the danger of him using and ODing, because of his medical history. Because he has no income and he has no insurance.
Okay.
I would suggest, or him going into detox, and just say 21 days, just to sort of kind of get a balance and see what he wants to do with the rest of his life. Yeah.
Got it. Again, so this is an area that, had you been speaking to him, you would have maybe introduced into the conversation. Yes, Deborah? And Megan did not do that, right? Okay. Yeah, Letitia, go ahead, please. She's calming her neighbors.
I would have.
So, sorry,
Dr. Holly, hold your thought for just a second. Go ahead, Letitia, and then we'll go to Dr. Holly. Go ahead.
Oh, so I was just saying, like, I think it's important to identify that Megan needs to work on identifying risky behaviors. As far as there was a few red flags, he had very little insight on his future. He's using a risky drug to risk overdose, and he's also has zero supports. So versus stating what I would have done with the client, it's more so like, what can we do? What can we work on with you, Megan, so you don't struggle in your next session with another evaluation of you need to improve your kind of like your antlers. Like, what can we do to improve that?
Yeah, and your hat's not on too tight, and yet you're identifying what Megan might need her awareness raised in so that it can be addressed during the particular conversation, as opposed to having to make a next session to maybe address those things. Okay, Dr. Holly, please, the floor is yours. And Beretta writes, I would also help him to make behavior changes, develop realistic goals. Okay. And Kristen writes, educating the counselor to meet the patient where they are at. Very interesting. Yep. Yeah. So we'll go to Dr. Holly, and then we'll go to Juliana, and then we're going to go forward. Go ahead.
So I'm between those two, with meeting the client where they at, and then understanding that Megan may not know what it looks like for somebody to be presenting as high risk. And third of all, I would have had a conversation with her, asking her why she didn't move him forward with maybe seeing the doctor or a nurse that day for an evaluation. Now, I would ask her only because I've worked in community health and at methadone clinics, and they may not had an appointment that day, and that's why she's telling him to come back that week, next week. So I wouldn't pounce on her for having him come back the following week. But I do think, though, in the between time, there could have been maybe further exploration, since she really don't know what it looks like for someone at high risk. But she could have helped around harm reduction, because what if his goal is not to be totally abstinent, right? Right, exactly. Now he seems a little bit all over the place, doesn't really know, but just her asking these questions, I'm pretty sure it was something, whether she referred him to another resource, a safe injection site, something around a harm reduction until we can get him back that following week. I think there could have been something done in between.
Yes. Yeah. And there's clinical supervisory experience that Dr. Holly stated that I want to underline before we go to Juliana and to Alexine. And Dr. Holly, you said this, and I love the way you said it, because it speaks to a very critical skill of the clinical supervisor, which is, I wouldn't pounce on her for that. And what that's connected to, and again, I love the way Dr. Holly put it, what that's connected to is, don't assume just because you're the clinical supervisor, you know all the details, because you don't. And built into what Dr. Holly also said was, Megan is a resource. And pouncing on resources makes them weaker. It doesn't build strength.
Great. So
just keeping that in mind, that I really appreciate the way you frame that, because that's a supervisory approach. If you feel the impulse to pounce, examine that, because that may be more about you than actually helping this person to become a valuable resource that helps clients. Juliana, thanks so much for your patience. The floor is yours.
In terms of just that initial reaction, one of the things I noticed is that he doesn't really know what he wants moving forward. Mm-hmm. But he also, I think if you did an ASAM on him, yeah, he would definitely, qualify for probably the highest level of care.
Yeah.
And so for me, it's, being able to recognize that, he really is in contemplation stage. And so allowing him to consider, I've heard people talk about harm reduction. I've heard people talk about higher level of care. And so even sort of just giving him those options and being able to say, look, I'm really worried that you're not going to make it till next week. If I have you come back in a week, are you still going to be alive? But I also recognize that quitting is really hard. And so, I'm trying to decide between referring you for residential treatment versus giving you fentanyl test strips or whatever. And right. Just to be able to express the gravity of his situation. But I think what Dr. Holly said was also really important, is that, being able to teach your supervisees how to recognize the gravity of a situation, right? Because master's level counseling students frequently do not get the education of, someone in an addiction with the confluence of medical risk, resource risk, social risk. This is an urgent, immediate need, and so that coaching around, and I've actually had this with supervisees who just do not seem to be able to tune into, just because the client doesn't see that this is a life and death situation doesn't mean that you treat it, as another day in the office. You need to be able to get you need to be able to see that information and say, oh, this is an urgent situation that we need to address, and I need to get my supervisor.
Yep. And yes. And, again, the thing I want to underline in terms of what Juliana said, because what you so clearly, from an informed place, from your own experience as a clinical supervisor, what you really described is helping people to develop their own awareness about the gravity of a situation. And even if the client is saying, I'm fine, it's how do you, and I mean, Tony is not saying he's fine, but he's also not saying my hair is on fire. And his hair is on fire. And what Megan has the potential to develop is ability to smell the smoke.
Yeah.
And then to be able to respond in a way that contains and mitigates some of the risk. And she doesn't have the experience at this moment to be able to do that. So here is an extraordinary opportunity for clinical supervision and professional development. And pouncing won't achieve that. Yeah. Juliana, was that a fair
Yep.
rendition?
That
Okay.
was beautiful.
Thank you. Thanks. Alexine, the floor is yours.
I concur with everything that I heard. But one of the things that I'm wondering might be missing in helping Megan to understand her patient is looking at him through cultural lenses. Because he is, he could be he is an immigrant.
Yeah.
We don't even know if he's documented or undocumented.
We don't know that. Yeah.
So that might be a factor why he isn't accessing resources that may be available to him, and the assistance that maybe he could tap into if he is documented versus not. And so in maybe helping him identify some of the resources, we might need to be aware of what in the community where he could go to get assistance if that is an issue or a factor to think about. So I think also in all of his risk needs, we also have to look at it through cultural lenses too. What else might be going on?
Yep. Thank you. And again, what a wonderful opportunity for the clinical supervision conversation to help raise awareness and introduce that as a factor. Kristen writes, express the importance of the MAT in high-risk patients who may not be ready to quit using or ready for inpatient treatment where they could feel restricted. Yep. Letitia writes, not only exploring identifying high-risk clients' urgency, also navigating and redirecting clients as well. Now, before we go forward, folks, I want to acknowledge something here. We're Megan's supervisor. So the thought now is we've listened to Megan's audio recording. So now we need to make the transition into how do we talk to Megan about this within the context of a supervisory conversation that's not pouncing, that's not punitive. And I'm thinking of Lourdes when I say this, because Lourdes, one of the things that you acknowledged right out of the gate was the strength that she brought to the conversation. And I want to underline that you acknowledge that. So as the supervisor, we need to be able to balance the strengths and the urgency of what needs to be addressed. So yes. Yep. Identifying the positive, ask her take on the session. Yeah, and what a wonderful way to begin as well in terms of kind of getting her take on it, getting her concerns about it, using an open-ended question to do that. So what I'm going to suggest that we do at this particular point, and it may seem like a surprising suggestion, but what I'm going to suggest is that we take our 15-minute break now, in a moment or two. We take our 15-minute break now. But what I really want you to be thinking about, I mean, do whatever you need to do. Eunice, I hope everything worked out in terms of the fire drill. Okay, good. What I'm going to ask you to be thinking about over the break, in addition to maybe having a snack or doing whatever you need to do, but what I'm going to ask you to be thinking about is the clinical supervisor opportunity is to engage in a conversation with Megan about what you observed, i.e. through the audio recording. Okay? So having said that, folks, let's take a 15-minute break. We'll come back. We'll talk a bit about Megan. And you may not have noticed this, but I have. We're already at 1:30 almost Eastern time, which means that we conclude promptly at 3. So we're beginning to round out our conversation. So just keeping that in mind. And Mizelle, I have not forgotten, we are going to have time to spend a little more on the professional development plan learning opportunity. So have a wonderful 15-minute break, and we'll see you in 15 minutes. Thank you. Welcome back, folks. I hope you had a good 15-minute break. I want to underline and sort of reiterate where we are, which is that we had the opportunity to observe Megan's conversation with Tony. And what we're thinking about now is how would we engage in a conversation with Megan about this opportunity to have observed her practice through the audio recording, through direct observation. And how do we have that conversation that identifies strengths, shares our assumptions about and our understanding about what maybe occurred, getting her take on it, and doing that in a way that builds her as a resource as opposed to causes her to feel pounced on, criticized, or in some way diminished. Okay, so that's kind of where we are. Now, to me, one of the gifts of this particular learning community opportunity in terms of clinical supervision 2 after the 14-hour training is that we're offered a particular model of how to engage in this particular conversation. So I'm going to just walk us through that model of how we can sort of walk through this conversation. And then I'm very interested to get your thoughts or your reactions to this particular model. And again, keep in mind, this model is a suggested guide of how you can have a productive, supportive, collaborative conversation with a supervisee that supports their professional development. And I'm thinking of the kind of the way that Juliana framed it when you were sharing your reactions about Megan, that she may not have the clinical experience. She may not have the understanding at this point in her career, in her development, to know when something is a high-risk situation. You know, I don't know about you, if you had this experience, but I've heard many people report that there's a huge difference from their educational training to when they actually are sitting in front of real people who are engaged in real behaviors that potentially could be putting them at risk. And there's an adjustment in developing the clinical understanding of, even if someone is minimizing that risk, how we want to address potentially a minimized risk. Okay, so I'm going to walk us through this particular model. I'm going to share my screen and walk us through this particular model. Now, keeping in mind, and if you can see the slide that says feedback defined, please just type a Y in the chat, just so I can make sure and confirm that everybody can actually see it. So excellent, good. Thank you so much. Wonderful. So there are two things I want to underline in regard to feedback. Well, let me ask you to do this, just as a way of getting into this. When you think of, we're gonna play a word association game just very quickly. When you think of feedback, so you think of feedback, What's the first word that pops into your head? Don't judge it. Just type that first word that pops into your head in regard to feedback. Okay, improvement, constructive, growth, gift, constructive, criticism, growth, learning, improvement, learning. Okay, excellent. Wrong. Okay, thank you, Eunice. Learning, Beretta says, excellent. So I'm asking you to do that, folks, because I just want to underline in a very quick kind of way that we all have a relationship and an experience of the idea of receiving or getting feedback. Some people experience that as growth and learning and an opportunity, and that's fantastic. And some people experience it as criticism, fear. It could be a variety of things. The thing that I want to underline here is that when we are engaged in a supervisory conversation with somebody, we want to keep in mind that feedback is really only helpful and instructive and a growth opportunity if it's specific. And I'm going to give a concrete example. If we were to say to Megan, and again, this is a gross example. It's not, I can't imagine anybody in our learning community saying this. I can imagine it being said, though, where a clinical supervisor with perhaps not a lot of experience or not understanding how to build, help people build their professional identities and practices could say something to the effect of, well, I listened to your audio recording with Tony, and it really didn't go very well. I mean, that's very general. It's also very critical and not very helpful. And the thing I just want to underline is that for feedback, whether it's growth opportunity feedback or to an earlier point, whether it's feedback of strength, it's not helpful unless you're specific. So you wouldn't want to say like, you did a really good job. You'd want to be specific. And I want to give a concrete example where you might say something like, Megan, as I listened to your audio recording, you provided a lot of space for Tony to talk. And some of the reflections you did really communicated to him that you were listening deeply and that you built a strong rapport with him. That's very different than a good job. So feedback needs to be specific. The other thing that we all have to consider as clinical supervisors, as trainers, as anybody, that any feedback that we give is subjective. It's coming through our lenses, it's our experience. So we need to frame it that way. It's our understanding of the situation, which, to Dr. Holly's point, may or may not be in command of all the details and the depth of what was going on. So in order for it to be helpful, it's specific. We also have to acknowledge, as the clinical supervisor, we are also offering our subjective reaction/observation. That's neither bad nor good. We just acknowledge that off the top, we're speaking subjectively based on our observation. So just keeping that in mind is the framework. The goal in offering feedback is that we help a person create an experiential, informational, as well as interrelational data bank of information and of the experience so that they then can choose with that information and that experience as to how they may proceed. And I mean the supervisee. And let me add another facet of what I mean by this. If we're interacting with the person, the supervisee, with Megan in such a way that they become defensive or they feel the need to put up a barrier or to protect themselves against our communications, we're not creating a data bank. we're actually creating distance. What we want to create is the opportunity for Megan to consider and reflect on what we're talking about and how we're talking together. So if Megan chooses to do something different in her next conversation with Tony or anybody else, that will be up to Megan. Okay, so just keeping that in mind.
Hey, Paul.
Yes, of course.
It's a comment. So we have to be very deliberate in the choice of words we use so that the feedback is viewed as positive, growth enhancing, vice criticism.
Yep. Yes. I couldn't agree with what Charles is saying in terms of we want to be clear about the choice of words. And Charles, tell me if you're okay with me adding this. And if you're not, feel free to reject it. I will add, and this is my subjective opinion, so I'm acknowledging it off the top. In addition to the words we choose, how we deliver those words, the tone of voice in which we deliver those words, the nonverbal communication that may precede or follow those words is also critical. Charles, are you okay with that? You're okay with that? Okay. So I want to be very clear that it is the words and it's the delivery of the words as well. And don't misunderstand me. That doesn't mean that we have to be like walking on eggshells. It doesn't mean that we don't have a clear communication about what we're bringing to awareness. But we want to be considering the impact through the words and through the delivery. Okay? Thanks, Charles. Any other comments or any other reactions before I sort of walk us through the oral model, OARL? I was going to ask earlier, is anybody familiar with the oral model? But I think I'll just have us walk through it and then share your reactions to it.
I was just going to say, based on everything that you just talked about, I see why trust is very important and why the relationship needs to be cohesive, because you want a person to be receptive and open. So as I'm listening to you talk about the subjective piece, it's more of where we're coming from and being that positive role model. A lot goes into this supervisory piece more than I really anticipated. So yeah.
Yeah.
A lot goes into this. Yeah.
Yeah.
Because
yeah.
it's like all
No, go ahead. So it's like all
it's all like that snowball effect that from when we first started, and really talking about that trust and that mutual relationship and role modeling and lunching together. You really have to really take a look at yourself. The supervisor needs to be mindful of themselves and how we our reputation with the agency is. So yeah. With yourself. Yeah.
Thank you, Eunice. And as you were saying that, Eunice, I really had a thought and I wanted to normalize it. And I don't know if anybody had this thought as they were hearing the Megan scenario. I will put out on the table, I'll go out on a limb and say this and make an I statement. I could imagine if I listened to Megan's audio recording and it played out the way it was described in the scenario, I could imagine as a clinical supervisor listening to that where I might feel a certain degree of alarm or panic. And I might feel a certain degree of frustration that Megan didn't get it. And I want to acknowledge and Eunice, this is so to your point, I want to acknowledge to myself, if I had that reaction, I don't want to judge that reaction as right or wrong, but what I want to be really clear about, and I'm thinking of Charles as I say this, is I don't want to communicate that panic or that frustration to Megan through my words, through my delivery, or through my verbal or nonverbal communication. because that's just my subjective reaction. It's not wrong or right. If I act that out, I'm not going to be able to have that productive, supportive, forward-moving connection that helps Megan to increase her capacities to respond to a high-risk situation. So I need, like what Eunice is saying, I need to be self-aware and not act that out. And the oral model can help us with that. So I'm gonna share my, yeah, go ahead, Charles, please. Before I share my screen, go right ahead.
I think as well, you have to be honest with, you talk about someone being receptive to the feedback. And when we're talking about high-risk situations, and I've had situations where a supervisee may not be receptive to that feedback, and it's, it's more, well, it's more of a directive kind of conversation, because because of the stakes are high here, and whether you agree or not, this is a policy you don't have to follow. I mean, that sometimes I have to have those conversations.
Yep. And Charles, thanks for putting that on the table, because I could imagine, like, if I had the great opportunity to collaborate with Charles, if I had the opportunity to be Charles's supervisor, and he said to me, well, Paul, I don't really agree with what you're saying, and I have a different take on that. Now, as the clinical supervisor, that could make me angry. I was going to say something else, but I chose to say that could make me angry or could make me feel frustrated. And what I would hopefully do is I might say to Charles, Charles, I want to thank you for sharing your perspective in regard to that. And I understand that you see it this way, and hopefully I would be able to specifically reflect back what Charles said. And I might also say, and Charles, the other thing that I need to lay on the table, and hopefully we can discuss, is that, the agency policy is, this is the protocol that has to happen when there's a high-risk person. And I want to get your take about how we can work together to make sure that that protocol is actually carried out. And I want to underline two things that I just did, hopefully demonstrated in a very clear but simple way, is I wanted to communicate to Charles, I hear you and I am listening to what you're saying. And I appreciate the fact that you're honestly telling me what you think and what your take is. And I need to also be very clear that this is the policy that all of us have agreed to. And how can we work together to achieve that goal? Now, my hope is that my word choice and my tone of voice would build collaboration between Charles and I, as opposed to distance. And maybe there still could be distance in the moment, but it could at least lay the foundation for future collaboration as well. Okay? So I really appreciate your point, Charles, because it's keeping it real. We have to acknowledge that there are some times when supervisors have to draw a very clear and bright line. Like in this program, under our policies, this is how we do this. And how do we come together to make that happen? So very, very valid point, Charles. And thanks for putting it on the table. Yes, Lourdes, go ahead, please.
Quickly, I'm a little bit with what your last said and Charles said, because what I'm seeing here is I am Megan, for example. I am Megan, okay? You said that you are my supervisor, but you said I would accept it's my own fault that I did not do things, that I didn't know anything. If you already laid it beforehand, the policy, it's clear right there. In other words, yes, I am a CASAC, but we need guidance too. So in other words, within this of agency as being an addiction counselor, as an addiction rehab, whatever, what is not. This is what we have here, okay? These things are all high risk. This thing. I am a supervisor now, reverse. I should know it. I suppose I should know it before I got to have 3-4 people down me. So in other words, the beginning of this, whatever happened, it's already clear. The ground is laid down. So in other words, I know this is just a scenario, but I'm saying, if I would say if that happened, I would accept, really, I didn't know anything. I'm dumb. You know, in other words, just my word. I wasn't, you know, but if it's already laid down, and even if I have my CASA credential, whatever, and I'm going to put it there. But you know, nothing could I resist from what you're saying. Whatever your feedback, I would accept it. This is really flat wrong. But if it's not, then what is your, but being my supervisor, what is your responsibility too? In other words, with this situation, that's why we're building how you're going to come to me. If I am now the supervisor, I'm now going to think, did I mention it before? Did we have it in a meeting before? Is this clear? Then why this Megan? Why Lourdes is doing this? You know what I mean? So that would my take here.
Absolutely. But I want to underline something, and I want to link it to something Juliana said earlier, because I think there's a connection, which is that it could be that the protocol is spelled out and Megan's read it. She signed a document that said, I read the protocol and I understand that this is what I'm supposed to do. And it still could mean that she doesn't know how, or she doesn't have the clinical expertise. So as the clinical supervisor, we have the opportunity to help people to put into practice what we actually need them to do in order to best carry out the services. So just because Megan may have read the policy of how we deal with high risk patients doesn't necessarily mean she knows how to do it, or that she has the clinical experience to be aware of that there was an emergency present. But that's the beauty of clinical supervision. We get to have a positive, hopefully collaborative discussion about it. Okay? So just keeping that in mind. So I'm going to walk us through this model that's called the oral model. And it's a very, I mean, it makes sense. The acronym makes sense in terms of its observe, report, assumption, and level. It's an odd, oral, because it's just strange. It makes me think of dentistry. I don't know why, but it is memorable. So we're going to walk through each of these pieces. This is the outline of the oral model, which involves these 4 components. In terms of the scenario with Megan, we observed, and this model is usually based on direct observation. We observed through the audio recording the interaction between Megan and Tony. In that conversation, we would report, we as the supervisor, using this model, would report to Megan what our take was on the conversation between she and Tony. And hopefully, and I'm thinking of Lourdes as I say this, hopefully we are coming from a strengths-based perspective. In our report, we would want to be starting with the strengths that Megan brought to the conversation. And we would also want to share our assumptions, which are an assumption that I might have might be something to the effect of, and this is very relevant to what we were saying, what Charles brought up about having to level, which is the last part of this model. But in the assumption, we might say, and I noticed that you didn't develop any kind of plan other than a secondary meeting to come back. And my assumption is that maybe you weren't sure how to help lower Tony's risk. So as the clinical supervisor, I'm offering my subjective assumption. And then I'm asking Megan what she thinks about that, what her take is on that. And what I may have to, in terms of the L part of it, the leveling, in terms of checking her understanding of what I am sharing with her. And I may reiterate to her, you know, as we go forward, working together in supervision, you know, one of the areas that we can focus on is how you develop the skills and the awareness to identify a high-risk situation and what the steps are in terms of to effectively manage that. That's the overall structure of the oral model. Okay? Now, there are a couple of other pieces to it to consider. So, and basically what that, again, that model sounds like there are a couple of additional pieces, but again, the observe, report, the assumptions, and then the leveling, what I saw, heard, again, because it's an audio recording, what I assumed or what my assumption was about it, and my reaction to it was this. And what's your thought about that? What's your reaction to that? And keep in mind, folks, this oral model is a way and part of the supervisory conversation that we have with somebody, okay? Now, the three more steps that we add to ORAL are that we ask permission to share the feedback in the beginning. We invite the person to reflect back to us or summarize back to us what we communicated to them, and that we kind of round out the conversation with mutual understanding around the accurate playback. So there may be dialogue about what Megan hears us saying and how we may clarify that so that we can come to a mutual understanding. So this is the whole model laid out. Megan, I had the opportunity to listen to your audio recording in your conversation with Tony. Would it be okay if I shared some feedback with you about that? Pause. Hopefully we have a collaborative relationship. Hopefully Megan she knew that, you know, I was going to be listening to her audio recording. And hopefully she's going to say yes to my sharing feedback. Then we would move to the report part of it. I would share my assumptions about the situation. I'd share some of the concerns or feelings that I might have about that, within boundaries, of course, appropriate, relevant to supporting Megan's growth. I would also share the impact of the behaviors in question, my concerns about that there wasn't an emergency plan. And then I would invite her to react or play back, share her feedback about it. And then we'd clarify any misunderstandings and any omissions. And then hopefully we would come to what is the mutual understanding of this. Now I'm going to stop sharing my screen for a minute. This is a guide, folks, about how to talk about what you may observe, okay? Notice, we're not talking about the professional development plan here, but this is just how you might have a conversation in order to offer feedback. This can be part of the professional development plan conversation, but ultimately, this is simply a model about how you can offer feedback within the conversation between the supervisee and the clinical supervisor. Okay? One thing I'll throw out for you to consider that can sometimes be helpful is practicing this model, because keep in mind, it's mechanical. There are particular steps to it. The broad aspects of it are the ORAL. The fine points of it are actually how you actually do it. And I'm going to link that to what Charles said earlier, is that it's the words you use, and it can be helpful to practice, and it's the way those words are delivered. that help build the rapport. Okay? Now, I want to take this model, this oral model that has these steps, and I want to link this into an overall supervisory conversation. But before we do that, I'm going to check in with Brittany Davis and just see if you have any thoughts or any reactions to what we've said so far.
Hi. So as far as I personally, so I don't know, I don't think it's necessarily unlike, what you're saying, but I like that there's the oral model, because then I like, and I think I mentioned this a couple days ago, I like the procedural, I like knowing this is the steps that I'm following, and, to stay on track.
Yep. And it's interesting, Brittany Davis, because you said that in day one.
Oh, was it day one? I knew it was one of those days. I like rules. I like to know, because then I know and they know, and everybody's on the same page. Yep. I like to be on the same page.
Yep. So this guide, in terms of its goal of helping the clinical supervisor and the supervisee to be on the same page. And it gives a map to follow as to how to do that. And again, I can't resist, because it's so integrally connected. I can't resist going back to Charles's point about the words and my addition of how the words are delivered and the nonverbal communication associated. And the thing I want you to keep in mind, folks, those are clinical skills. Those are clinical skills that you can practice and refine. Okay, I'm going to share my screen again. So, I didn't create these slides, folks. These are slides that were created and are part of standardizing and connected to the 14-hour course that you did online. You'll see that the title of this slide is Supervisory Interview. If I had created these slides myself, and based on our work together in our learning community, if I was going to retitle this slide, I would retitle it Supervisory Conversation. Because to me, interview implies I'm going to be asking a lot of questions. And conversation means, to me, there's going to be bi-directional, as you can see under purpose point number 1, that there's going to be bi-directional feedback. And when I engage in a supervisory conversation, I strive, and this may not surprise you given our interaction within our learning community, hopefully it won't surprise you, I strive for bi-directional feedback and communication. I want to know what the supervisee thinks. I want to be open to the fact that I can learn from the supervisee.
Quick question.
Yeah, go ahead.
I don't know, and I haven't seen this, and maybe I haven't read far in the book, but I got my hand slapped by my old program director when I was a supervisor at a methadone clinic, because 1, there was not an evaluation form. I created a form, and then 2, I created a form to get feedback from my supervisees. Now, I don't know, again, if that's regular practice or not, but I'm human just like they are. They're therapists. I'm a clinical supervisor. I needed to know for myself if I was at least giving them what it is that they had wanted. Was I meeting a level of standard that we both had identified as to this collaborative exchange of a relationship? And my program director lit into me and was like, this is not what we're doing. You're not to ask. It was kind of just like an
authoritarian.
Yeah. And I don't feel like I'm above reproach from a supervisee. So the supervisees I have now, they're basically like in private practice that I see. And I still do check-ins, and I ask them like, hey, when we first initially connected or met, this is what I said I would deliver based on what you wanted. And I still do these check-ins. So can you speak a little bit to that, and one, is this something that should we do? Because it just seems so one-sided when we look at like developing this PDP for the supervisee. But what about feedback from them about us?
Absolutely. And I will respond to what you're saying, because if we had another hour, we could talk a lot more about that. But what I want to add, Dr. Holly, is you're committed as a clinical supervisor to satisfied supervisees. And you want their direct input into whether the clinical supervision is working for them or not.
Mm-hmm.
And the only way, not the only way, a way you thought to approach that was to invite them to comment directly on that. What I can tell you folks, and I see Juliana shaking her head as well, what I can tell you folks, when I am in the role of clinical supervisor, I will often say to supervisees, we're in this together, and I'd like feedback about whether you're getting what you need from this. And that's where that bi-directional communication can become very relevant. Now, I think the only caution to consider is we don't want our need or our desire for feedback to overtake the goal of the supervision. And that's a boundary issue again.
Yeah.
So I think, and again, as you were describing getting your hand slapped by your supervisor, it made me kind of think like, what a missed opportunity there. Because had I had the opportunity to be your supervisor, I would have been really curious as to what process you went through, what you found out from your supervisees, what was your method, and if I had concerns, hopefully I would have shared my assumptions about it. I would have used the oral model.
And I think the reason it wasn't somewhere about, okay, let me kind of rewind. Earlier,
Please.
A lot of us was talking about how we have been thrown into these positions. And so for me, I became a clinical supervisor and director very early in my career.
Mm-hmm.
And I think I knew what to do from like trainings and things like that, but I still needed to make sure that I was delivering appropriately based on each individualized supervisee. So for me, that's what started. I'm like, wait a minute, how do I know if I'm actually delivering adequate supervision?
Yep.
If I don't have some level of like communication from their end, because if it's just one-sided, they're just getting all this feedback from you, and then you have no idea how you're being received, perceived, whatever.
Right. Absolutely. And keep in mind, folks, that's not clinical supervision. Clinical supervision is not it being one-sided. Clinical supervision is a dialogue between the supervisee, just like using the scenario. Hopefully, the clinical supervision is going to be a dialogue between Megan and the supervisor. And what Megan has to offer is going to be of equal value as to what the supervisor may offer. And that is a very important and considered distinction about effective clinical supervision. It's not one-sided. So thank you for putting that on the table, Dr. Holly. Now I see that there's a massive dialogue going on in the chat, and I just wanted to invite all the participants in that dialogue, if there's anything you'd like to share verbally in regard to what go ahead, Juliana, please. Yeah.
So I just wanted to validate Dr. Holly, because I've also done the same thing, but the fact is, page 118 in tip 52, which is treatment improvement protocol for supervision is a counselor evaluation of the supervisor.
Thank
to
you.
aid in evaluating the supervisor and the supervisor in assessing the counselor. And so the fact that this is part of SAMHSA's official codex tells me that hand slapping was totally out of line.
You know, you heard it here, folks. Hand slapping was totally out of line. If there's one thing you walk away with from our training, our learning community conversation, hand slapping is out of bounds. Fantastic. And talk about like tone of voice, word choice, nonverbal communication. I mean, would any of us individually want to walk away feeling like we'd had our hand slapped? So why would you want to create that dynamic in a collaborative relationship you have with the supervisee? And P.S., I don't know exactly, a number of you have mentioned this, but P.S., clinical supervision is an opportunity to model ideal practice. So Dr. Holly gets her hand slapped, and then she meets with a client, and she chooses to slap the client's hand. Exactly. Dr. Holly's like, no, no way. Absolutely. So again, I just want, yes, we just take the bruises. Yes. And you know something? That's fantastic. Well, no, it's not fantastic. What I can say is fantastic, and I'm going to be specific because I'm going to give specific feedback, is that sometimes people can have adverse experiences and not act them out on the next person that they interact with. That's a high-level skill. It requires tremendous resiliency in order to be able to do that. And my hope is, and again, I'm so thankful to have had the opportunity for all of us to be together in the learning community, because our conversation gives me tremendous hope that supervisees are actually going to get what they need from you as clinical supervisors, and that you are going to bring a standard and a quality and a respect to your supervisory interactions. And that makes me feel really hopeful, and it also makes me feel really privileged to be part of, and as someone who gets to participate and facilitate this particular conversation. Having said that, I'm going to share my screen one more time. And I'm thinking of Brittany as I say this. I'm thinking of both Brittany's, but I'm thinking first of our two Brittany's. One Brittany has identified very strongly the desire for structure and guidance. And this is a wonderful, 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 simple matrix that lays out what the supervisory, again, they're calling it supervisory interview. I fully own my subjective bias toward the word supervisory conversation, but this lays out very clearly and very simply what can be the supervisory conversation structure. You'll notice step 1, set an agenda. Step 2, give feedback. Step 3, teach and negotiate. Step 4, secure commitment. Talk about guidance. Now you'll see that objectives are laid out for each of these particular steps. And you'll see that there are tools that can be used. And if you're kind of putting the pieces together, and if you're highly observant, which of the steps, and you can type it into the chat, which of the steps are you noticing includes the oral model? And you can just type that into the chat. Which of the steps are you noticing includes the oral model as one of the tools? Yes, it's step 2. And again, I mention that to you because that method of communication is embedded in a overall structure of a supervisory conversation. And I want to underline something very specifically and distinctly. And if I was able to highlight or a note, maybe I can. Let's see if I can do it. And I'm using one of the tools of, I really want to, I'm not doing it in a very good way, but I want to, a note, I didn't do it very elegantly here. Oh, and it just disappeared. But I wanted to a note, empowerment and individualized supervision. And this totally connects with what Dr. Holly and what Juliana were saying about how we need bidirectional feedback from our supervisees in order to engage in a supervisory conversation that actually meets their needs. So this is a structure that can support your supervisory conversations, and your supervisory conversations that would include discussions about the professional development plan. Oh, I see that there's something in the chat. I'm just going to check. Okay, good. Somebody, Zachary and Kristen, also noting step 2. Excellent. So, council. Yes, go right ahead. Yeah.
Is the slides in the workbook? Where can I find it?
Yeah, it's in the slide deck, and you'll notice it says participant workbook, page 59.
Page 59. Thank you.
Yep, you're welcome. You're welcome. So, folks, we are now moving into, and this is where we have a little less than 30 minutes now, but this is where counselor development and growth, and I love this little image here, growth all connects to the idea of the professional development plan. We have the oral model. We have that embedded within the supervisory conversation or interview as it's framed here. And now we're at the place of the professional development plan. And you'll notice these 7 steps in the growth process. I love this slide because it just kind of lays out common understanding of supervision. Well, you know something? We talked about that supervisor in one of the scenarios, that supervisee in one of the scenarios earlier on a prior day, who had very bad experiences in clinical supervision, became reticent to take risks or share what was going on. Part of the growth process in building a collaborative relationship is achieving a common understanding of what the supervisory conversation and what the purpose of supervision is. The idea that we're considering the uniqueness of every supervisee, that firsthand observation of job performance is probably one of the most effective ways to craft meaningful feedback. Based on that, we can assess strengths. And it's interesting because some people may read number 4 here, assess strengths and priorities for improvement. Supervisees could even read it that way. And I want to underline something here, and I'm going to try and emphasize it with my voice. We want to assess strengths and priorities for improvement. Both have to have air and space and be part of the conversation. Again, that part of the bi-directional conversation and interactivity of a supervisor, a clinical supervisor, and a supervisee is feedback and coaching to enhance awareness. And I'm particularly thinking about Megan, the scenario with Megan. We also want to be able to negotiate a plan to guide the process. The professional development plan, we may do our first draft of that. And what's to stop us, and I'm thinking of Juliana and Dr. Holly when I say this, what's to stop us for sharing our draft professional development plan based on our assumptions with the supervisee to get their feedback and their input about how we measure and assess their professional development, their progress. So, a couple of things to keep in mind, and this is just touching back on what we said before. Cultural sensitivity is critical to this process, and our subjectivity. We need to become self-aware. We hopefully can engage in a supervisee-centered relationship. And doesn't that sound like what Dr. Holly said to us on day one? My foundation is person-centered. And we want to be able to be culturally responsive. And you know that part of cultural responsivity with supervisees is continuing to do our own cultural growth, which is a lifelong process. There are all kinds of these elements that can impact the supervisory conversation. Differences and similarities in any of these, and probably, a number of other differences. But these things need to be overtly considered and discussed in order to help people get on the same page. Again, these are some of the things, 10 sort of strategies to consider here for building relationships with supervisees. And what I'm going to ask you to do is I'm going to ask you to look at these 10, and I'm going to give you a moment to do it, although it is cutting down on our question and answer period. But I do want to give you a moment to look at these 10. They're not put in order of priority. But what I'm going to ask you to do is use the chat to identify, and again, it's a forced choice, and I apologize for that. If we had more time, we could discuss these in greater detail, but I just want you to get a sense of, as you continue your own self-awareness as a clinical supervisor, which one of these strategies for building relationships kind of jumps to the top for you? Which one of these are you most attracted to? And just type the number in the chat. There's no right or wrong here. It's just the one that's most attracted to you, that you're most attracted to. Okay, so, yep. 1, create collaboration. 7, 2, 10, 7, 7, 4, 8, 8, 2, 7. Yeah, excellent. 1 and 10, 8, 10. Now, the thing that I want to note for everybody here, you did not hear me say 5, 5, 5, 5, 5. You did not all pick the same one. You're not all picking the same one. And the thing that I want to underline there is that's a strength, because your self-awareness will help you to develop your own personal model of clinical supervision. No two of us in this learning community will engage in the supervisory conversation in the same way. If each one of us were sitting down and talking with Megan after having developed a professional development plan, if each one of us were sitting down with her, it would be a unique conversation. And I want to encourage you and support you in continuing to raise your awareness about your unique model of clinical supervision. And again, you can use the oral model. You can use the matrix that lays out how to have the supervisory conversation. And hopefully you will bring your uniqueness and your responsivity to that supervisee, to that supervisory conversation. And I want to underline and encourage that in terms of what you do. And developing your unique supervisory style and voice is probably something, hopefully, you're continuing to do for as long as you're continuing to provide clinical supervision. So we can avoid generalizations and assuming that any two supervisees are alike. We can, and I'm thinking of Dr. Holly as I say this, because of the idea that, and I think it might have been Juliana who wrote this in the chat yesterday, we can't know what we don't know. And we need to, one assumption we can be sure of is we don't know everything. So we want to acknowledge that folks think and perceive and act in ways that may seem absolutely alien and bizarre to us. And we can be curious and find out and be educated by them. And again, we can inquire and be curious about things as opposed to making assumptions. And again, do not imagine you know all there is to know. I'm reminded of that on a daily basis. So these are the elements that make up the professional development plan. These simple bullets, a target competency, and you know which instrument in terms of counselors we're going to be using, what tool we're going to be using, and another tool that we'll be using in companionship with that first tool. To identify a competency, we also want to identify the person's strengths. We want to identify the concerns that we have and identify the knowledge, skills, or attitudes that the professional development plan is going to focus on. We then craft the learning activities and are very clear about the measures of progress. If when you sit down to do this work, this learning opportunity, practice opportunity that you have after this conversation today, when you sit down to do this, if you start to get overwhelmed about completing the professional development plan, come back to this slide and just reorient yourself with these 6 bullets. In your work, you're going to be identifying 3 target competencies. For each one of those, as they apply to the scenario that you're looking at, you're going to be identifying the counselor strengths, the specific concerns as the supervisor that you have, the identification of the knowledge, skills, and attitudes, the learning activities that will help them to achieve that, and then the measures of progress. So if you start to feel overwhelmed, come back to this slide 110, because it can reorient you, so hopefully you'll feel less overwhelmed. This is something that is not new to any of us at this particular point in our learning community conversation. You'll see that there's the foundational dimension, practice dimension, and the competency to be addressed. And notice it says competency from TAP 21. One competency from TAP 21. The strengths and the challenges, the present level of proficiency as you determine using the rubric, the knowledge, skills, or attitude associated with that competency, the goal that you're trying to achieve, the activities, how the progress will be measured, and the completion dates. Again, you can always go back to slide 110. So this slide, 112, gives you the instructions of what you're going to do. You're going to decide on a foundation, practice dimension, and a single competency. You're going to do 3 for the supervisee that you're developing the professional development plan for. But you're going to do 3. And you decide on those one at a time. You're going to describe the supervisee's strengths and your concerns. You're going to assign the proficiency level from the rubric, which you know is the companion tool. You'll select 1 through 3, the knowledge, the skills, or the attitudes from the TAP 21 target. You'll define the goal you want the supervisee to achieve. You'll create a list of activities to be completed. Slide 112, in addition to slide 110, are your friend in this next step. And again, identify how the progress will be measured and determine a deadline date for each activity. Okay. Thank you. Now, before I show you the very last slide, I'm going to stop sharing and let me apologize by saying We do not have 30 or 40 minutes remaining, but we have about 15. So I want to open it up to see if there are any additional comments, questions, concerns about developing the professional development plan and the next steps. And Brittany Davis, I see that you have your hand raised. And before we go to you, before you speak, I'm going to ask everybody to type in the chat the 2 slides, the number of the 2 slides that are your friend in helping you to complete this next step in our process. So if you remember the number of those 2 slides that are your friend, that I told you you could go back to reorient you if you feel confused or concerned, just type those numbers. Yes. Thank you. That is it. Brittany Davis, the floor is yours.
Hi, question. So on each competency, it says the knowledge, skill, and attitude. Is it you have to have one of each per competency, or it's just one of those areas? Because, somebody might be good in one with the knowledge, but not the skill or the attitude. Right.
You got
it. It's just one of them. It's not all of them.
It's just the area for growth.
Okay, gotcha. I was thinking that it had to be all 3 of them. And I was like, but
what if that doesn't apply?
Right. So that was my question. Okay.
I'm looking so forward to getting your professional development plans. And I'm very hopeful, either in this context or in a future context, we're going to get the opportunity to be in a learning community together. So I'm going to show you the last slide. Please take the time to complete the evaluation, and very much looking forward to reading your professional development plans. I can't thank you enough for everything you brought to this learning community. Thank you. Thank you for making it so rich and for making it so valuable.